Namaskar, I am Dr. Subhayan Bhattacharya. I am critical care in charge of Spandhan Hospital, practicing medicine in North Kolkata. I'll be sharing few updates and few views regarding hypertension as latest updates. I just want to share that as per WHO, nearly 63% of total deaths in India are due to non-communicable disease, of which 27% are attributed to cardiovascular disease, which affects 45% of people of 40 to 69 years of age group. So almost more than half person is dying due to non-communicable disease, and most importantly cardiovascular disease. And as we all know that the hypertension is the most important risk factor for cardiovascular disease. Most importantly, the cardiovascular disease plays an important fact that hypertension is remaining very poor controlled, and most of the patients of hypertension remain unaware till it is detected late stage. In India, the prevalence has also gone up for 30 years to 38% in men and 32% in women, from 29% and 28%. So in recent days, we have seen a hike of incidence of hypertension. Despite that, nearly half of the people, that means 51% in men and 41% in women with hypertension, were unaware of the condition. That means they don't know that they are having hypertension, and definitely it's a big challenge for us. Additionally, over 62% of the men and more than 53% of women living with hypertension did not get treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women. That means the most importantly, hypertension remains undetected, and even it is detected, it is poorly controlled. Both men and women shows definite substantial degree of unawareness regarding their status of hypertension, and the amount of drug has to be taken to control the hypertension in an optimum role. International Society of Hypertension has released the ISH 2020 Global Hypertension Practice Guidelines that cleared our confusions, and there are practically set guidelines for the drug to be used and the direct target of hypertension related issues. The inclusion of optimal and essential treatment paradigms attempts to address the issue that in resource-poor settings, optimal care refers to evidence-based standard of care. The next issue is that ACCHA has released scientific statement in 2021 offering a new guidance for management of stage 1 hypertension among the patient with low atherosclerotic cardiovascular disease risk. Among low-risk adults with stage 1 hypertension, blood pressure 130 to 139 and 80 to 89. Management starts with non-pharmacologic therapy. That means lifestyle modification, dietary restriction, like that. If the blood pressure remains uncontrolled at 3 to 6 months, consider starting pharmacologic therapy. So definitely, it's not about the pharmacology and it's not about the business. They have clearly stated that the lifestyle modification should be encouraged first to control the hypertension. Then after that, the pharmacological therapy should be started as early as possible if the hypertension status is not controlled properly. Acute respiratory distress syndrome is a potentially fatal condition involving lung damage, and experts' opinion often associated with severe COVID-19. A recent study shows that the patients with hypertension and poorly controlled hypertension cause a more degree of lung inflammation in COVID-19 compared to the non-hypertensive counterpart. So definitely the Journal of American College of Cardiology reports that the metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19, including ARDS. So this is one important data. We have shown that using metoprolol in COVID patients not only reduces the blood pressure, reduces the catecholamine overactivity during the ARDS pathogenesis, and most importantly, the increased heart rate that can lead to tachycardiomyopathy will also be somehow released, somehow controlled by using metoprolol. Another important update is there, lowering systolic blood pressure targets down to the 110 to less than 130 range substantially reduces CV adverse event in the STEP randomized trial, affirming the SPRINT findings in an older Chinese population. So definitely we have studied SPRINT trial. The SPRINT trial says the low as you can. So if a patient can tolerate as low as 110 by 70 blood pressure, the achievement or the outcome regarding cardiovascular disease is better. Another one update with regard to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, 2018 European guideline on the management of arterial hypertension recommend that the diagnosis of hypertension should not only be dependent on BP measurements, but also out of office measurements, which includes ABPM. So definitely ABPM plays an important role diagnosing the latent or secluded hypertension. For every 20 to 10 increment of BP measured at night, the risk of mortality increased by 23% and risk of cardiovascular events by 36%. So that's why we definitely encourage doing ABPM and most importantly, doing a sleep study. Somebody definitely says that there are many snorings in improper sleep. So the blood pressure regarding the night time or sleep time, the rise may cause some amount of problem. So that has to be diagnosed properly. The European guidelines equally recommend 5 classes of antihypertensive drug considering high non-adherence treatment. The importance of combination treatment is particularly highlighted to improve adherence therapy and other things. So there are no specific drugs to start with. All the classes of antihypertensive are equally effective and you can use it at your preference. The next update is in July 2018, products containing valsartan have been recalled worldwide. The reason is the detection of known carcinogen named NDMA, which can be found in candesartan, irbesartan, losartan, olmesartan, and valsartan. NDMA has been classified by the WHO International Agency for Research on Cancer to be carcinogenic in humans. If 1 lakh patients would have received NDMA contaminating valsartan from a specific manufacturer, obviously in China, every day for 6 years in highest dose, it could result in 22 additional liver cancers over the lifetime of these patients. The presence of NDMA in these drugs could lead to 8 additional cancer cases in 1 lakh patients if they had taken the highest daily dose over 4 years. Valsartan recall accompanied by the significant increase in the rate of emergency department visits to plus 6%. So definitely telmisartan was excluded from this list. And right now, the recent production of valsartan is definitely free from NDMA. So if you are taking a sacubitril valsartan combination, you can take safely. And the last update from my end is HYGEA study represents the largest study that tested nighttime hypertensive treatment. In this trial, chronotherapy was associated with significant reduction in endpoints. The HYGEA chronotherapy trial tested with nighttime therapy in comparison to usual upon awakening hypertension therapy exerts a favorable CVDs reduction. So the largest study included a total of 19,084 hypertensive patients during an average follow-up of 66.3 years. 1,752 patients experienced a primary CV outcome and ambulatory BP measurements were performed 48 hours to collect data on BP deferred during sleep. The reduction of CV events was significantly improved in nighttime treatment when compared to awaiting treatment. So probably if these things is good, we can found that most of the cardiovascular events occur early in the morning. So nighttime blood pressure control is very much important for optimal control of blood pressure. So sometimes we can give our medications at night and that will give better results than prescribing after breakfast or awakening therapy. So that's it. These are all recent updates. So definitely we have to focus on detection of more and more amount of latent hypertension, and we should not have any static inertia before prescribing the adequate medications. We should use the medications upfront to control the blood pressure. And definitely these are all updates which can guide our treatment modalities and our treatment approach. Thank you very much. Thank you.